Thank you for joining us on the program, and again, a warm welcome. We begin with what is some cheering news for the Democratic Republic of Congo, DRC, as its government declares after 42 days without a new case, the Ebola outbreak in the country's Équateur province is over. The country's health minister, Oly Ilunga Kalenga, announced on Tuesday, rolling out the statistics recorded in what was the 9th Ebola outbreak recorded in the country.
The Ebola epidemic in the Democratic Republic of Congo has officially ended. Congolese Health Minister Oly Ilunga Kalenga made the announcement on Tuesday after no new cases were reported in the past 42 days. The epidemic, which broke out in the northwest of the country last April, killed 33 people. The World Health Organization and the Congolese authorities reacted quickly by giving out an experimental vaccine against Ebola to more than 3,300 people. But according to the WHO, it is mainly the humanitarian response that has limited the virus to Mbandaka, a city with a population of 1.5 million, connected to the capital Kinshasa by river. An Ebola outbreak is generally declared over 42 days after the last confirmed blood samples were tested negative for the second time.
And we are joined on the line by Minister of Health, Dr. Oly Ilunga. Hello, Mr. Ilunga. You announced the official end of the Ebola epidemic that broke out on May 8 this year. What is your assessment of this 9th epidemic? First of all, I think it's been a great success. It's been about teamwork. There was extremely good collaboration between the experts, the Ministry of Health, and various partners, and the various agencies involved.
Du ministère de la Santé, les différents partenaires, les différentes agences qui étaient impliquées.
You know that we have a response plan with a whole series of components, and everyone has been involved and contributed their expertise to the response. For me, it's really the feeling of having done excellent work, and I believe that it's the collaboration of everyone that made it possible to obtain this result.
Qui a permis d'obtenir ce résultat en un temps quand même assez rapide.
Unlike previous epidemics, this one has been contained very effectively, thus limiting the number of deaths. What contributed to this success? I think what contributed to this success was that we started from a base where we had known expertise in the country with a response plan that had proved its effectiveness in the past. I think what was also very important was the fact that all the players, all the partners, aligned themselves under the leadership of the government in our response plan. People did not come with alternative response plans. They aligned theirs with our priorities. I believe that this alignment under the leadership of the government is an important element. What has also contributed to this success are the new approaches and the new strategies. You know that the vaccine was first used on nearly 3,500 people, really broke the chain of transmission of the virus in the community quickly. I think that another important element that prevented the spread of the epidemic even beyond the province of Équateur was that all the mechanisms had been put in place, surveillance at every point, ports, airports, road, parking lots. I believe that all of this made it possible to have an effective response. The DRC has already faced 9 Ebola epidemics. How is the country organized to prevent possible future epidemics? The virus exists in the forest, so I believe that at the scientific level, we are not yet able to eradicate the virus. So the virus stays in the forest, just as the flu virus stays in the communities. Here we have a virus that remains in the forest, so the risk of having the 10th epidemic is not impossible. I think we could have another outbreak. The challenge is that we are still in a system where awareness is higher. The level of alert in the population is much higher. Our defense system has also been strengthened. So all the conditions are in place with the new technologies to ensure that there is a second epidemic. We will have to ensure that it remains sporadic and that we do not end up with a major epidemic.